Welcome to our brief presentation analyzing risk communication during COVID-19 pandemic. This is part of the capstone project through Kennesaw State University College of Computing and Software Engineering. For this project, we sought to assess and analyze the relationship between public health advisory statements during the COVID-19 pandemic and the trends on new infections in Singapore. We wanted to know if social media is an effective way to communicate mitigation strategies, if there's a correlation between public health messaging and confirmed positivity rates, and are there downward trends in daily COVID-19 positivity rates when mitigation mandates are issued. Singapore, again, is our focus. The population of Singapore is roughly 5.7 million. There are 4.3 million active Facebook users, 1 million active Twitter users, and roughly a 4% engagement rate in Facebook. We focused on tweets and Facebook posts from the Singapore Ministry of Health. That's considered the official channel to receive updates regarding the COVID-19 pandemic. We combined those posts and categorized the text with machine learning. We came up with discrete categories for statistical analysis. We also looked at the World Health Organization daily case trends. We took daily case counts from the World Health Organization's database and used that in our analysis as well. And the main analysis was statistical modeling, and we also had some data analysis and visualization. In order to better categorize the data, we had to complete additional analysis using deep learning multi-class classification model. This is where we came up with our social media topics and categories. We combed through each post and grouped things into categories using this deep learning multi-class classification. Our findings. So through our analysis, one of the things that we sought to identify was how did users respond to government topic choices? And as you can see here, the most frequent topic posted in Facebook is dorms and outbreaks, which is the second most shared topic. On average, the most shared topic was tracing, regarding contact tracing procedures and origin of infections. And the Facebook post with the most shares was on May 19th, which is where they announced the end of circuit breaker restrictions. Facebook post with the most likes was on May 28th, when they confirmed the exit of circuit breaker restrictions. And Twitter users' reactions were negligible, averaging 6 shares and 13 likes per post. So we focus more on Facebook for this analysis than Twitter. Is there a correlation between public health messaging and confirmed positivity rates? There were no strong correlations between any of the topic frequencies and the average number of infections after 14 days. The software did find 2 strong correlations between average daily cases and precautions and lifting restrictions. And these correlations likely indicate that the officials increased the frequency of precautions messages as the cases start to increase and decrease them as the infection rates dropped. We used Pearson correlation, which was calculated in SPSS. We compared monthly frequency by topic to new cases, daily average, and new cases after 14 days. And we compared the monthly frequency for each educational behavior to new case daily averages and new cases after 14 days. We also looked beyond topics. We wanted to analyze the behaviors versus case trends on Facebook. And this graphic shows the daily messaging or behavior message rates. You can see the list to the side about the messaging. It also shows the daily average of new cases. And this we sought to just show visually the messaging that was going out as well as the case trends at that time. The message content follows infection trends, but clearly there are ups and downs in the trends. Certain actions that could explain changes in infection trends. The emphasis on hygiene and mask usage range between 2.5 and 9.52%. The MOH places greater emphasis on telecommuting and avoiding crowds. Both of those messages peak in March. and travel messages peak in March as travel advisories go into effect. This is a timeline of the infection trends and the government mandates. Here you can see the different significant actions that the government took in regard to COVID-19 infection rates. And you can also see the effect of that after 14 days. So for example, you can see a spike in cases 7 days after a mask mandate went into effect. And then if you move a little bit further down, you can see that the cases actually dropped after the mask mandate. Thank you for watching our presentation. Please visit our website to read our complete analysis and to learn more about our team, and the link is listed below. We do want to give special thanks and acknowledgement to Dr. Shirley Tian and Dr. Ming Hong for their guidance and support throughout this project. Again, check us out on our website to get the full picture of our analysis. Thank you.